The expansion is very important for Dartmouth-Hitchcock Manchester. It's one of our older facilities, and they are currently at capacity. When you think about how care is changing, many of the procedures that we used to admit a patient to the hospital for are now actually done on an outpatient basis. We currently have a lot of apprenticeship programs that we're going to have to start thinking about ramping up a little bit more. For example, this facility will require surgical techs, will require pharmacy techs, will require MAs, additional nurses. And so we can leverage a lot of our programs to actually increase the volume of people that actually move through the apprenticeship programs. I think, when you're growing, people feel really positive about moving ahead. And we see this as a positive metric in terms of growth and expanding access to patients in the area.
We are doing our best to design the building that will allow for the ability for it to adapt in the future, so that if practices needed to expand or contract, either on an hourly basis or a yearly basis, that they can without major disruption to operations.
As DH moves the surgical services into the Manchester area, it's going to offer to our patients in that southern region the very convenient and local space for their health and surgical care. This project includes 6 operating rooms and 3 procedural spaces, but it also offers a completely renovated medical office space and service expansions. The Manchester ASC is designed really to be a patient-focused environment, with patient and staff satisfaction being top-rated priorities. ASC is an ambulatory surgery center that is really focused on same-day surgical procedures.
This site has been in development for about a year. We've been in formal design of this site since fall of 2018. Certainly the design itself is exciting. It's using state-of-the-art technologies. It's a beautiful site. I think we found ways that we can utilize new technologies and enhance the patient experience.
Medicine is changing, and substantial parts of the way we deliver care are moving into ambulatory environment. I mean, if you looked at things 25, 30 years ago, a lot of what we did was in the hospital. So that's shifting. There's a lot of surgical procedures, there's a lot of treatments, they're ambulatory. It's clearly going to be a wonderful space. I mean, it incorporates a lot more modern techniques and workflows. Our current building is 20 years old, and it's in very good shape, but it isn't ideally suited to you wouldn't design it that way today. So this is going to incorporate a lot of good features that it's going to be very good for everybody to work there, whether it's providers or staff.
Our patients really want to be in one level of care. They want to have a continuity working with their provider. So if you're having surgery with your particular surgeon, you'd like them to be able to bring you into their hospital where they work all of the time, and into a hospital that is specifically designed for this patient population to be able to provide the best level of care.
We want our patients to be able to walk into a site, receive acute primary care, preventative primary care, so our urgent care centers, for our patients, just for our patients. We have a really good primary care base. Any specialty service that you might need, we want you to be able to connect with a specialist, whether that's in-site or within our system. And that level of connection with our specialists could be general specialty-based work, general orthopedics, general gastroenterology, or if, heaven forbid, that leads to a need or a diagnosis that's life-altering in the you have cancer diagnosis or some sort of other acute specialty need, you're part of a system that you can get that. that you can get the technological workup associated with that care. If you have a life-altering disease, you have access to those services as well. And quite frankly, this expansion allows us to say, short of an inpatient need, local inpatient need, you can actually get your surgical procedures done in one setting.